we're going to look at the congenital rubella syndrome. Rubella syndrome. And along with this, we are also going to deal with the rubella. So first, we are going to start off with some questions. So the first question we want to ask is, what are the triad of the congenital rubella syndrome? So this is our first question. And the next question we want to ask is, what are the diagnose? How do you diagnose the congenital rubella syndrome? So here we will find the answers to these questions and learn in detail about this topic. So to start with, first we need to know the triad of Gregg. So what is this triad known as? It is the triad of Gregg. G-R-E-G-G. So this is present in the congenital rubella syndrome. So here the triad of Gregg includes the ear. So it is the sensory neural. It's a sensory neural hearing loss. So it is nothing but the sensory neural hearing loss. So what does this include? So in the sensory neural hearing loss, it includes the presence of nerve deafness. So there is the nerve deafness, and this is the single most common finding among the infants. Most common in the infants. Next, we also have the congenital cataract. So we have the congenital cataract, and then we also have the CHD, which is nothing but the congenital heart disease. So in the congenital heart disease, the important thing to know is that there is PDA, which is the patent ductus arteriosus. So it is present. Now to move on, we also have the maximum damage. So there is a maximum damage to the fetus. There's maximum damage to the fetus, and it occurs in nothing but the first trimester. And the infection, if you see, look at the infection in the second trimester. There is infection in the second trimester, and this causes only deafness. This causes only the deafness. And other thing to note is that in case the infection, so this occurs after 16 weeks. In case the infection occurs after 16 weeks, what happens? So if the infection occurs after 16 weeks, there are no major abnormalities. No major abnormalities. This is important to note. Next, what about the diagnosis? So how do you diagnose a case of the CRS, that is congenital rubella syndrome? It is the presence of the IgM rubella antibodies. And this is in the infant. Shortly after birth. So it is in the infant, found shortly after the birth. And there is also the persistence of the IgG antibodies, and this is greater than the 6 months. Now, just to highlight some clinical features, it has the bilateral cataract. That is bilateral cataract. Next, there is the blueberry muffin rash. There is a blueberry muffin rash. And after this, there is also the salt and the pepper fundus. The salt plus pepper fundus. So this was about the CRS. Now we look at the rubella. So what is the rubella? So let's write it down. Rubella. So the important thing is that the rubella is also known as the German measles. And what is a causative organism? The causative organisms, it belongs to the family of the Metona-viridae. So it belongs to the family that is the Metona-viridae. So what is the period of infectability? So the period of infectivity is -5 to 6 days. It is nothing but -5 to 6 days after the onset of the rash. After the rash. Then in case of rubella, there is also the droplet transmission. Then what about the incubation period of the rubella? Incubation period is about 2 to 3 weeks. Then we look at the spots. There are some special spots which is known as the Forchheimer spots. So this Forchheimer spots, it is seen which are tiny. So basically it is tiny. It is rose. It is the rose colored lesions and lesions of the oropharynx. Oropharynx. So this is associated with the post-infectious thrombocytopenia. So it deals with the post-infectious thrombocytopenia. Then looking at the most serious complication. The most serious complication, what does it include? So it includes the encephalitis. Encephalitis. Now we look at the vaccination. So how is the vaccination carried out? So the vaccination is with live. There is a live attenuated the RA273 strain of the rubella. So now we will proceed to answering our questions. So the first question we asked was, what are the triad of rubella? So looking at the triad of rubella, the triad is known as the triad of Gregg. And what does it include? It includes the sensory neural hearing loss, SNHL. So it is a nerve deafness. It is the most common. So it is MC, that is the most common finding in case of the infants. Then there is also cataract. So basically it involves the ears, it involves the eyes, and it involves the heart. So here there is also the congenital heart disease. So specifically the patent ductus arteriosus. Now moving on to answering our second question. So what was our second question? Second question was about how to diagnose it. So diagnosing it is by the presence of the IgM. So there is the IgM rubella. There is IgM rubella antibodies. IgM rubella antibodies. And this is occurring in the infants. So it occurs in the infant shortly after the birth or the persistence of the IgM antibodies. So there's the IgM antibodies which are present greater than 6 months. Now to check our concepts, we are going to ask further questions, bonus questions. So in case you know the answers, you can answer it in the comments. So the first question we want to ask is, what is the Forchheimer spots? Explain the Forchheimer spots. What is it and which disease is this Watchema spots present? This is the first question. The second question is talk about the vaccination in case of the rubella. Rubella vaccination. What is the vaccination given to rubella?